In fact, the benefits to society as a whole may be tremendous. I mean, essentially an outpatient surgery lasting 90 minutes as opposed to however much it costs to get 7 weeks of radiation therapy. I mean, these things have to be looked at a policy level and at a society level. And hopefully we'll do that in the next 5 years. I think there has been a lot of interest in comparing treatment modalities with the heightened emphasis on how we're spending our healthcare dollars. A lot of policymakers and many insurance companies, I think, are very soon going to ask which treatment overall is most effective. There was interesting work from the University of Toronto, I believe, or a group in Canada. Kevin Higgins published this at last year's head and neck meeting in the summer of 2008 that showed that that laser surgery is economically, at least in the Canadian system, more cost effective than radiation therapy. When you factor in the cost of salvage, the cost of salvaging, again, 2/3 of those patients, perhaps with a total laryngectomy, quickly makes radiation therapy unaffordable.
Well, the cost is significantly different. T1 glottic lesions, so tumors of the vocal folds at the earliest stage, are frequently done as an outpatient procedure, an hour or two of surgery at most, and the patient goes home. When you compare that to treatment with radiation, which has been the standard of care, which combines 5 days a week between 6 and 7 weeks of visits, that becomes very cost differential compared to an outpatient surgery. So it's much more cost effective. As long as you feel that you can accomplish the same level of voice quality for these patients, then I think it's a no-brainer. But people are reluctant because there's lots of historic data that showed that radiation had improved voice outcomes. That's certainly in question now, and many believe that there is not a difference, that we have equivalent voice outcomes. So that's a big difference. When you look at the ability to preserve function through the use of transoral laser surgery, it also is significantly different. As for instance, last week, before coming to this interview, I had a patient who had a T3 glottic tumor, excuse me, a T3 supraglottic tumor. He underwent an endoscopic resection of his tumor and underwent a neck dissection. He had no nodes, he had no trach, he had no peg, and he went home on an oral diet with his drains out post-operative day 3 with a voice and swallowing. So that's hard to argue with if you think about what would have happened for an open procedure or also chemoradiation therapy, with the significant expense associated with those type of modalities as opposed to a short hospitalization.
The findings of different studies indicate that the total cost of radiotherapy is significantly higher than that of laser surgery. So the oncological and functional results were convincing. This was a start for the most cost-effective treatment for early cancer.
Definitely, endoscopy surgery assisted with the GLRQ blade is the cheapest way to treat a patient. If you speak about cancer surgery or about cancer treatment, I guess this is the same in the United States that it is in Europe. The patient won't stay for a longer time in hospital. He can go back home in the evening or the day after or a few days after in case of more extended surgery. It's definitely less expensive than radio chemotherapy, for sure.